resource you recommend for patients with CAD?
So there are, a couple of different support groups that patients can access online. If you just Google, CAD support groups, I think that those are great resources. They, provide them an opportunity to talk to other patients, but they're also very involved in providing, education for patients and caregivers. I've spoken at them many times, as well as, many of my colleagues. So I think that those are some really good resources for patients.
How quickly does the treatment landscape of CAD evolve? And what do you think we can expect within the year?
Well, it is a rare disease. And so, collecting enough patients to participate in clinical trials that have the power to, show benefit is a little bit tough. Within the year, I would imagine that we will see mature data from the phase 3 trial from the pegcetacoplan or the C3 inhibitor. We do continue to accrue data in the long-term follow-ups for sutimlimab. Um, I think, thinking on the horizon, may we get some more data from daratumumab, potentially. And then, in thinking about the advances that are being made in the world of immunomodulation, could we potentially, see trials that are initiated to better address that low-grade lymphoproliferative process? Whether those will be, approved therapies within the year is probably unlikely, but I think that, there is a renewed interest in looking at this rare autoimmune hemolytic anemia for therapeutic interventions that may, in fact, benefit our patients.
What are the most important things for primary care providers and other non hematologists to know about cold agglutinin disease?
I think the most important things for people to know are to think about putting that symptom complex together, and then also to be aware of the symptoms that may be indicative of thrombotic phenomenon. So, looking for evidence of thrombosis in patients who are short of breath or have dyspnea on exertion. Remembering that a lot of these events were cerebral. And so, thinking about looking at brain CTs or brain MRIs to see whether, these patients are having mini strokes. We can intervene with anticoagulation to be beneficial for these patients in those circumstances. And I think, sometimes maybe patients aren't seeing the hematologist regularly, but they are seeing you as a primary care provider. So being aware of the possibility that your patient's symptoms could be related to thrombotic events, I think is probably one of the biggest takeaways.
Is thromboprophylaxis ever appropriate for patients with CAD? What about in winter?
Yeah, so I think you have to really evaluate your own individual patient from a risk benefit profile. It when the consensus meeting was held, there wasn't enough data to support the recommendation of generalized thromboprophylaxis. But certainly, if you know that your patient experiences a significant number of hemolytic events during the winter, or they experience a certain significant number of hemolytic events in general, consideration of thromboprophylaxis, I think, is very reasonable in certain patients with cold agglutinin disease, but it is not a generalized recommendation across the board for every patient.